Right. Very excited to be back with Grazel Garcia again. How are you feeling today, Grazel?
I'm doing good, Scott. Thank you for being here with me again.
Yeah, absolute pleasure. And today we're going to be discussing dual relationships in therapy, which I know is a little bit of a hot topic, a little bit of a controversial topic sometimes. But Grazel, how would you define a dual relationship?
A dual relationship, by definition, is having two relationships that shouldn't be together.
Hmm.
So it would be personal and professional together, mixed together.
Hmm.
And so for therapists, we can't have a personal relationship with anyone we're treating in therapy professionally.
Okay. And why is that? Why does that boundary have to be there?
There's a lot of important factors that play in. So, because the personal relationship and professional relationship is so different, that if you mix two together in therapy room, there could be patient exploitation that could happen. The patient is not aware of what they need at times, but the therapists are.
Hmm.
So the therapist can use their power and privilege to manipulate the situation if there's a personal relationship. I'm not saying that therapist is intentionally going to do that, but the therapists hold the power, right? And our job is to make sure that the patient's safety is our first priority.
Hmm.
So if we're adding a personal relationship there, then you know that we're no longer looking at probably the best interest of the patient.
Yeah. So what could happen in like a worst case scenario if say you're giving therapy to your friend or someone you know in a personal capacity.
Right. So, for example, and I get this a lot, right? Like there's friends that feel more comfortable to talk to friends. And
Mm.
so when friends come to me and they say, I want to see you professionally, I have to be very clear about how working with me as their friend is going to affect them because I know them and I have a bias and a prejudice that I'm going to be bringing in the room.
Hmm.
I know them personally, so I can't separate that. It would be really, really difficult for me to separate that in the professional room.
Hmm.
The relationship can be a little murky if we combine it. It can be enmeshed
Hmm.
and it could taint the relationship overall because if let's say you're my best friend and you're bringing something up and there's so many things I know about your relationship
Hmm.
that I know you have a role in playing maybe a negative cycle, and if I say that to you, I may have a feeling of being afraid to hurt your feelings, and then the patient, my best friend, could feel hurt by what I'm saying because
Yeah.
she's no longer seeing me as the professional.
Yeah. How
She's
can
seeing me.
it's like how can you say that? I thought you were my friend. Yeah.
Yeah. It's very tricky. So, in a professional setting, in a therapist-patient relationship, it's so important to keep that clear and
Mm.
be boundaried in that type of relationship.
Mm. No, I get that. So, do you ever have situations where the lines get a little bit blurred for you, and you find yourself kind of operating a therapist as a therapist when your friend comes to you with a problem, not in the sense that they're asking for your help as a therapist, but you just kind of slip into that mode?
Yeah, um, I'm I can't speak for other therapists, but for myself, I'm very good at boundary setting because I just have to practice boundary setting very, very well in the work that I do. So if a friend comes to me
Hmm.
and they're looking for help, then I'm there first as their friend before a professional,
Yeah.
right? Like, because that's my relationship with them. So personally, I will tell them, look, here's my professional input about it, but I'm not your therapist, but this is what you can take
Yeah.
to help you. However, if you need more support, I can be here as your friend. but I can't be here as a professional for you.
Yeah, and I can see how that's a really fine line because as a therapist, you obviously have so much expertise in terms of navigating relationships and talking talking about those kind of deep-seated problems. And for you, I guess it feels very strange to kind of turn that off because you don't get into therapy if you don't want to help people in that way. Um,
Yeah, right. So I'm still there, of course. Like as therapists, we're able to provide, like provide psychoeducation about something.
mm,
Hey, if my friend is saying, "Hey, I'm having suicidal thoughts," of course I'm going to help and say, "Hey, here are the resources that you need to do," and then probably talk to the family and provide them the resources. But that's not me providing treatment. That's just me knowing the resources that's available for my friend to use,
yeah,
right?
yeah, yeah. No, I hear that. Is there ever a way that you can ethically work with a friend or a work colleague? Does it depend on how close the relationship is?
So not all dual relationships are illegal.
Mm,
There are dual relationships that can happen so long as there's great communication about the relationships they're getting into and making sure that there's no harm done with either parties,
mhm,
right? So, for example, um, I have I do a lot of trainings in EFT.
mhm.
So I work with EFT trainers, but also one of the EFT trainers is my clinical supervisor
Okay.
in a way that's not, it's a little bit different because I'm not gaining hours anymore to become licensed, but I'm paying the supervisor
Yeah.
to consult with me. That's not a dual relationship, but it's tricky because we have to um, act differently. I can't bring in my relationship as a fellow trainer that trains other therapists locally into the work in supervision,
Yeah.
right? So, but that's not a dual relationship.
Yeah. It's like where does the power and authority lie? Because she's your supervisor, but you're training her. So how do you negotiate that? Yeah.
Or we're training together. So she still like carries more power over me.
Mm,
So the responsibility of taking care of me falls on her, but it's
mhm.
still not a dual relationship.
Yeah. Yeah.
Um, sometimes it could mm, there sometimes what happens where there's other therapists that are new in the field that may be seeing a couple
Mhm,
in couples counseling and they start to see each partner in individual counseling.
mhm.
That's illegal. That's not okay. We can't do that. We can't treat a couple in individual therapy. That's considered a conflict of interest, a conflict of relationship, almost kind of a dual relationship, right?
Right. Yeah.
Um, there are situations where dual relationships can be tricky, but it can work. It can work as
Mm,
long as legal boundaries and ethical boundaries are implemented,
mhm.
right? So
Yeah.
it's just tricky, but
Yeah.
but the professional knows best.
Yeah. So there's a very clear legal standing, and then there's this grey area where it's a maybe, maybe it can work. But on the flip
Mhm.
side, you can enter into a professional relationship, and then over the course of therapy, you obviously get into so much deep stuff. It can sometimes cross into a personal relationship from there. So how do you navigate that side of things? Like if the therapist or the client starts to feel, hey, you're starting to feel more like my friend than my therapist right now, what happens then?
Um, I welcome patients to talk about whether the work that we're doing is feeling less professional for them. And when they talk about that, it's always very helpful because as therapists, we can adjust the work that we're doing so that it caters to their needs. So if it's feeling more friendly, then the therapist should adjust and stay away from that type of relationship,
Hmm.
right? Um, if it's feeling like the patient is no longer able to see the therapist as the professional, then we
Hmm.
can talk about it and see if it would be best to refer them out
Hmm.
as opposed to continuing the work. Because then, if the patient is no longer seeing me as a professional, they won't open as much to me.
Yeah. Okay. Yeah, that's interesting. I would have thought if you're feeling more friendly with your therapist, you'd open up more. But are you saying it's often the other way around?
There's moments where there can be a friendly type of interaction, but that's kind of based on what the patient needs. Like I have a lot of patients that are just being who they are with me. And I meet that. I
Hmm.
meet that part of them that shows up, and it could be like a friendly vibe,
Yeah.
but it doesn't necessarily change my professional outlook
Yeah. Yeah.
in providing the service to them. If they say to me that they're becoming more friendlier, then I want to open up about what that means for them.
Hmm.
And if it's transference that's
Hmm.
coming up, then I process it in the room.
Yeah.
But sometimes being friendly with a therapist helps them become more vulnerable.
Hmm.
And if that's a way in, then I think that's okay. That's that's not a problematic. That's not a dual relationship. That's just a protective strategy. So long as I hold my professional lens, it's okay if they're friendly with me or not. So long as I'm not becoming friendly and I'm not doing my professional, you know, work as a therapist, that's the problem.
Yeah. Okay. Yeah, I get it. That's a really interesting topic to cover
Does,
a little bit.
does
It's
that make sense?
yeah, yeah, it does. It's just whenever you're dealing with this sort of emotional work, it's so easy to get blurred boundaries, and it's great to hear how you kind of enforce those boundaries. Because it is really it's just so important to make sure that everyone's on the same page. And as you say, it's about safety in the room and all that stuff. So yeah, thanks so much for that. That was really helpful.
Okay, great.